Well, good morning, everybody, and a very, very warm welcome to our 2013 conference. Of course, the challenge for me this morning is to fit my presentation in 15 minutes, and being a home care provider, that's not easy, as I know you'll be aware. Anyway, it's a pleasure to be here at the Kia Oval, the home of Surrey Cricket Club, and as you know, cricket is very much in the headlines at the moment, with the heat of Australia proving too much for our players, at least for the time being. Let's hope we can turn things around. And as a sports lover, it hasn't been great to be an Englishman in the last couple of weeks, unless, of course, like me, you're an Arsenal supporter and then you feel a bit better. Anyway, thanks for taking time out of your schedules to be with us today. We're delighted with the turnout, and I want you to know that your commitment today is very much appreciated. And commitment is the key word at this current time, because without your commitment, the delivery of home care in this country would be even more of a sorry state. And being a provider myself, I know that commitment is being sorely tested at this current time. And part of the reason that we have such a good turnout today is because you are concerned about the delivery of quality care. You're concerned about the way that home care commissioning is going on at the moment. You're concerned about the way home care is continually portrayed in the media, and concerned at the way the government and some local authorities treat this vital sector of ours. And those of you who know me will testify that by nature I am a glass half full person. But at the moment, even I am having to look very hard at that glass at the moment. And when I sat down to write my introduction a little while ago, I thought, what do I actually say, and what do I leave in, what do I leave out? And I've been in social care almost 25 years, and it seems in some ways that we don't seem to have moved on very far. If I might just use some cricket terms, because if you know me, I would use some sporting terms, it feels as though we've lost the toss, the opposition is bowling bouncers and googlers left, right and centre, and any minute now we're all going to be out. All around us, we are hearing calls for higher quality care, and condemnation of the things that detract from that. This week, care providers are being condemned by HMRC for failing to pay workers the national minimum wage. Well, let's talk about the national minimum wage, shall we? Government talks about naming and shaming providers who fail to pay the national minimum wage. But I say, what about naming and shaming commissioners who fail to commission care properly? As a body, the UKHCA will never condone or excuse providers failing to pay the national minimum wage. But my view is that we aren't alone in this. The severe underfunding of social care in this country is partly to blame for providers' failure to pay the national minimum wage. It is a shared issue. Some providers are at fault, yes, but it's also a local authority and a government problem who must take some of that blame as well, must share some of that blame. We warned about this many, many years ago, and I would say again, well, what do people expect? And as commissioners cut back on what they pay for care, it is inevitable that what providers pay their staff will come under intense pressure. No responsible employer would knowingly not comply with the national minimum wage regulations. Understanding how it works with varying shifts, weekends, bank holidays, enhancements, annual leave and travel time is not easy. And as Bridget said in her opening address, to help providers, we have produced a toolkit to help providers with that. And when some local authorities only pay for contact time, pay by the minute, or reduce the lengths of visits, we are told not to bid. But it's just not as easy to not bid for that contract. Jobs, livelihood and businesses are at stake. The government had made a commitment to have CQC include commissioning within their remit. That would have enabled them to check on their commissioning practices. Not only would this have looked at fee levels, but also at 15-minute care visits, another area where condemnation had been long and loud. And we really want to move away from time into outcome-based commissioning. We've said that many times, and we've said that over many years. Still not happening. But as you know, the government scrapped its plan to include commissioning within the CQC remit, despite the Equality and Human Rights Commission recommended that CQC monitor commissioning. I would ask, how can we all achieve improvement when one of the key players, those who buy the care, are exempt from scrutiny? Is this another area where we are most definitely not all in this together? Today, we will call upon government to reverse its decision and include commissioning within CQC remit. Let me just say a little word about commissioning. I agree wholeheartedly with the comments made in a recent blog published by the British Association of Social Workers, and if I might just remind you what it said. It said, "The commissioning models that are employed need to be urgently revisited. The hard-nosed purchaser-provider split rarely works in the manufacturing industry, and such a model is not appropriate in these sensitive times, particularly in domiciliary care. Social work is about developing relationships and problem solving. Manufacturing has learnt that having good relations between suppliers and purchasers is essential to enable continuity of supply, to solve problems, and to ensure good quality. Manufacturers work very closely with suppliers so that these problems can be solved and quality improved. We are tired of home care being commissioned by commissioners who often have no experience of frontline practice, whose imperative is to get the lowest possible price without regard to the quality of the service or needs of the client. As you know, home care and indeed social care in general is right in the public spotlight. We had Health Secretary Jeremy Hunt talking about the national shame of lonely and forgotten older people. Headline after headline, deriving report after report, all scrutinising the care that providers are able to provide with less and less money. Last week, we had the Care Quality Commission in its State of Care report highlighting the fact that too many older people would be admitted to hospital rather than cared for in the community and in their own home. We agree with that, and we have said for many years that we can help provide that, but are we listened to? I know in my own local area, not one comment has been made from the commissioners about us working on that. And in response, the Care Minister, Norman Lamb, spoke about people falling through the cracks between health and social care. Can this really come as a surprise? With local authority after local authority come back on how much home care they provide, by tightening up their criteria, it is inevitable that more and more people will miss out. People might be falling through the cracks, but those cracks have been created by chronic underfunding of the sector. Now, I'm prepared to say that as providers, we don't always get it right despite our best efforts. What I would like to say is, but when did you last hear the government admit that it doesn't always get it right in terms of funding social care and properly integrating health and social care? I can't remember. Can you? We all want better social care, and we want older and vulnerable adults looked after with care, dignity and compassion in a way that does not involve hurried visits. But I'm not convinced that the way to achieve this is by criticising again and again the work that you people out there do. And I'm certainly not convinced that we can achieve it by starving the sector of the resources it needs. I wonder what the endless negative headlines are going to have or are having on the morale of your staff. As Geoffrey Howe said of Mrs. Thatcher in his resignation speech of 1990, and to revive that cricketing analogy once more, striving to improve social care at the moment is rather like sending your Oaksman batsmen to the crease, only for them to find, the moment the first balls are bowled, that their bats have been broken before the team by the team captain. Amidst all this, do we ever hear anyone ask what it's like to be a social care provider in 2013? We hear condemnation and criticism and calls for tougher regulation. We hear talk of the system creaking and broken, but with little understanding of what it's like at the sharp end. Having to provide home care when commissioners are paying £9, £10, £11 an hour, dashing across busy cities to fit in visit after visit and not even getting paid for travel time, having to squeeze a visit into 15 minutes when humanity and common decency cry out that it should be longer. And what it is like to be a hard-pressed, committed home care provider, that when a carer misses a visit or is late on more than one occasion, that CQC fail you on one of their standards. It seems to me as though care providers are almost as popular as bank executives or energy providers at the moment. We are an easy target, get little support, despite the fact that caring for people in their own home is a central plank of government policy. I'm going to have to speed up, I'm being told at the back a little bit. So now I know what it's like delivering 15 minutes. I'm just going to read this statement out to you. It says, unless the government takes urgent action, older people may not receive basic care to help them stay at home. Hundreds of thousands could lose or have to pay for the little services that mean so much, like help with washing or getting dressed. And when do you think the local government association made that statement? This year, last year? No, I pictured out a speech I delivered a few years ago. It was 2007, and I guess we could say the same words today. I say get sufficient funding into social care, commission care in a way that gives providers a chance to properly care for people, and in a way that doesn't penalise for travel time. Then, ladies and gentlemen, we will see home care delivered consistently across the UK in a way that people deserve. There is much to be proud of in home care. Your courage, your spirit and steadfastness typifies what providers do. We've got to make sure that that job is rewarded properly. The sector makes an enormous contribution to social care. It employs 1.5 million people and contributes £20 billion to the economy. And that's a message I hope that the Business Secretary will listen to. And the UKHCA is doing its best to support you through these challenging times. We have boosted our membership in the last year by 300 people. They come from a range, statutory, voluntary and private sector providers. We've got to make sure that we further strengthen and raise our voice. We mustn't give up. We've got to be unified, and we've got to make sure people hear us loudly. We've continued our campaign using that voice. Care is not a commodity. We've been in the very heart of the media debate on television and radio, and we've never enjoyed such a high-profile year, but we've got to keep that going. It's an honour for me to continue to chair the UKHCA at this time, and I want to just add, as Bridget did at the beginning, to thank our sponsors today, Towergate, Patrick, and the other main sponsors, Malinco and NRS, and our media partners, the Guardian Social Care Network.